Dr. Gary Bellman, let's discuss thickness of blood and testosterone. There are those of you who believe that testosterone causes thickness of the blood and therefore an increased risk of heart attack or stroke. Is that true? Well, let's explore. What does the blood do? The blood carries oxygen, that's its main function, to the rest of the body. And when the blood count is low, the blood is thin, anemic, you're weakened because your tissues don't have enough oxygen. And thicker blood carries more oxygen. So hence, the thickness of the blood is measured by hemoglobin hematocrit. That's how we know the levels. So what do athletes do? If an athlete has a competition, he or she may go to a high altitude where the oxygen is low and compete. And in the days and weeks that they're there, their body will compensate and make thicker blood. And when they go to their competition, whatever it may be, a fight or whatnot, their blood will be thicker, they'll have more endurance. Their blood will carry more oxygen and serve them better in their competition. Similarly, Lance Armstrong allegedly took testosterone, epogen, and blood transfusions, make his blood so thick that he didn't fatigue during his competitions. None of these athletes developed heart attack or stroke. What does testosterone do? Testosterone does the same thing as going to high altitudes, but it does it quicker. And it does cause blood to be a little bit thicker. But thicker blood in and of itself doesn't put you at risk for a heart attack or stroke. 80 to 85% of patients on testosterone have mild increases in hemoglobin hematocrit, and they are not at risk for a heart attack or stroke, and they don't need to donate blood. 10 to 15% of patients, many of which who have sleep apnea, which will increase their hemoglobin hematocrit, have to donate some blood. So when you're monitored by a physician, he or she should check your blood tests every 3 months, and periodically we tell patients, Mr. Smith, go to the Red Cross and donate some blood, or go to the hematologist and donate some blood, and they get the benefits of testosterone with safety because their blood doesn't get too thick. So yes, theoretically, if they're not monitored, their blood can get too thick, especially if their doses are high and they have sleep apnea. Take-home message, the majority of patients don't need to donate blood and are not at risk for a heart attack or stroke. And as long as you're being monitored and told to donate some blood, all that is fine, so there is no concern.